Okay, hi, Assalamualaikum to my lecturer, Dr. Zulkarnain, and all my friends. So today we would like to present in our part, which is a spine injuries. Okay, my name is Afika binti Zulani. I am the first presenter, and my group members is Nurhayani, Muhammad Izzuddin, Muhammad Iqmal, and Sashdati. Okay, now I will present in my part, which is the anatomy of spine injuries. Okay, spine is the vertebral column that has 33 bones that call a vertebra, and also separate by the intervertebral disc. Next is the column is divided into 5 different vertebral structure, which is the cervical vertebra, thoracic vertebra, lumbar vertebra, sacrum and coccyx. And also spine have a function, which is first it can protect the spinal cord within the spinal canal, and also as a support it can carry the weight of the body above the pelvis. Next, it also can form the central axis of the body, and lastly it can help in posture and movement of the body. For example, in the cervical vertebra, we have a C1 and C2, which is atlas and axis, that the function can allow the movement of the head. Okay, next is classification of the vertebra. Have a 5 classification of vertebra, which is the first is cervical vertebra. Okay, cervical vertebra has 7 spinal column, which is C1 until C7, but in cervical vertebra has a unique and a special spike, which is C1 and C2. C1 is atlas and C2 is axis, and their function is can allow for the movement of the head. Okay, next is thoracic vertebra. Okay, for thoracic vertebra, it have a 12 spinal column, which is T1 until T12. And thoracic vertebra is a medium size, and the size it will increase. The size it will increase from the superior until from the superior to the inferior. So the size it will increase, and their specialized function is to articulate with ribs and producing the bony thorax. Okay, the third is the lumbar vertebra. Okay, for lumbar vertebra has a 5 spinal column, which is L1 until L5, and it has the largest in the vertebral column. And also their specialized function is to support the weight of the torso. Okay, next is the sacrum. Okay, sacrum a wedge-shaped bone that is below the 5 lumbar vertebra at the base of our spine. Sacrum actually is the large and have a flat triangular shaped bone rested between the hip bone. So sacrum located at the middle of the hip bone. Okay, and then lastly is coccyx. Coccyx has a 3 part, but from the 3 part has a 1 part that can support for a person in the sit position, and coccyx is a small bone which articulate with the apex of the sacrum. So coccyx also is known as a tailbone and located at the below of the sacrum. So lastly, this is the example of our spine. So from the cervical, we have C1 until C7, and next is thoracic. which is T1 until T12. Next is lumbar, L1 until L5, and has a sacrum. And also lastly, the smallest part in our spine is coccyx. Okay, so that's all from me. Thank you.
Hi, Assalamualaikum. I am the next presenter. My name is Nurhayani binti Nur Azhar. Today, I would like to present about the mechanism of spine injuries. There are many types of mechanism of injury. Firstly is hyperextension. Hyperextension is an excessive posterior movement of head or neck. The causes of this hyperextension is, for example, brake emergency and car accident, or sudden backward acceleration of skull, creating extreme extension of cervical spine. The effect on the bone is cervical strain injuries. Secondly is hyperflexion. The hyperflexion is an excessive anterior movement of head onto chest. The causes is on the head recoils forward and suddenly stops on impact with another object. The effect on the bone is cervical strain injuries. Next is compression. Compression is weight of head or pelvis driven into stationary neck or torso. The causes of this compression is fall or of greater than 10 to 20 feet onto head or legs, or blow on the top of the head by some object falling into the head. The effect on the bone is vertebral compression at lumbar spine. Next is rotation. Rotation is an excessive rotation of the torso or head and neck, moving one side of the spinal column against the other. The causes of this rotation is rollover accidents and motorcycle accidents. The effect on the bone is cervical spine injuries. The fifth is lateral stress. This lateral stress is direct lateral force on spinal column, typically shearing one level of cord from another. The causes of this lateral stress is T-bone accidents and fall. The effect on the bone is cervical spine injuries. Lastly is the distraction. This distraction is an excessive stretching of column and cord. And the causes of this distraction is child inappropriately wearing shoulder belt around neck, or snowmobile or motorcycle under rope or wire. The effect on the bone is cervical spine injuries. That's all from me. Next, we continue with the special test or the skill test.
Hi, Assalamualaikum. My name is Muhammad Izzuddin bin Nizam. In this video, I will show you the special tests that are often performed to assist in diagnosing the musculoskeletal injuries. For the spelling test, first you ask the patient to extend their head, rotate to the affected area. Next, the therapist need to compression downward the head of the patient slowly. Positive spelling test result means you feel the pain radiate into your arm during the test. So the doctor and the therapist will stop the test as soon as you feel the pain. For compression test, the patient need to sit with a natural head position. The therapist standing behind the patient and put a hand on the head and put some compression downward toward the patient head. positive signs of compression test is a radiating pain on the same side of the arm and the local pain to the neck or shoulder. For the Faber test, first you need to ask the patient to lying down in supine position and then take the flatted side of the leg into external rotation and then press downward gently into the flex knee and the anterior superior iliac crest. The positive symptom of Faber test is pain in the sacroiliac area, indicates a problem with the sacroiliac joint. So this Faber test is suggestive but not confirmative. So we need to using the SI joint injection for the confirmation of SI joint problems.
Assalamualaikum, my name is Muhammad Iqmal Yusof. Today I want to show you some special tests in focus in thoracic and lumbar spine. Let's go, enjoy my video.
So I will continue the slide presentation for do and don'ts for spine injury. If you have spine injury, you have to do regular stretching exercise. This stretching exercise will help you to reduce your pains, no matter how much you hurt. But if you can't get to continue for stretching, you better stop it. The exercise that you can do is like yoga and tai chi. Second, do get regular chiropractic massage. Massage is the most enjoyable things that you can do for your back. The doctor will assess your injury and take a look at your spine to see if there are any joint dysfunction or restriction that may have played a part in the injury. It can help you to get your normal activities back. Third, do pay attention for your posture. A good posture can avoid you from having back pain. Fourth, sleep on your side. Put a pillow between your knees to give support and stop your back twisting. 5. Do apply ice. If you feel twinge, you have to get an ice pack on that affected area as soon as you can. The ice will help you to reduce inflammation and control your pain. Put the ice about 20 minutes at a time for 2 to 3 days early. For don't Don't sleep on your stomach. This can worsen your back pain. This position will put the most amount of pressure on your neck and can cause constant head and neck pain. Second, don't look down at hours at a time. If you're sitting down, your lower back can bring havoc on your neck. If you're looking down at cell phone or reading, you have to take a break. Stretch your neck and back at least every 30 minutes. Third, don't sit for a long period of time. You have to move your body for every 30 minutes to help you to prevent from injury. Fourth, don't perform certain activities that can make you more pain. You should avoid exercise like running, lifting weight, and sit-up because it can cause your more back pain. 5. Don't carry heavy objects such as a backpack because it will make your lower back more pain. So for the conclusion, there are many causes that can affect the development of spinal cord injury. When the spinal cord is injured, your brain can communicate properly, and so sensation and movement will be impaired. Serious complications will result. Quadriplegia and paraplegia are not managed carefully. Exercise is a great way for most individuals with spinal cord injury to improve their overall health and ability to do everyday activities. Okay, that's all from us. Thank you.